Okay, good afternoon, everybody. Today we're going to talk about a topic that is very common, but also very frustrating to parents. It's what we call emotional meltdowns, or basically intense outburst of emotions that children have. So we're going to talk about what this emotional dysregulation that children show us, and trying to prevent these meltdowns, how to handle the meltdowns. As I was going through this, there was a lot of information, so I decided to put this in two parts. And today we're going to be doing part one. So let's start talking about terminology initially. So some people use the word tantrum, some people use the word meltdown, some people call it explosions, and none of those are really medical terms. It's just so what we're really trying to say is when a child cannot regulate their emotions. We tend to think about tantrums as occurring, that kind of 2-year-old temper tantrum. That's something that's pretty much developmentally expected during that phase of the terrible twos. The child is expressing strong emotions before he's able to express them in a socially appropriate manner, before he's able to talk. And these rages can be stomping their feet, throwing things, screaming, throwing themselves on the floor. And it's kind of the way the child communicates his or her feelings. They often begin around a year of age. They continue until they're about 2 or 3. Happens mostly with parents. And then they begin to diminish as the child is able to communicate more effectively. However, remember, an older child who may have a speech delay, they may persist because they also cannot communicate. What works best for a young tantrum, which again, young tantrum, these probably go until about 3 or 4. What works best for a young tantrum is usually just staying calm, ignoring the tantrum if you can, and being careful not to give in on a regular basis to the tantrum. So because that can become learned behavior. So if you have something like a reinforcement, so in other words, so you go to the store and the child wants a candy bar, and they throw a tantrum, and of course maybe as a parent you don't want to be embarrassed, so you get the candy bar for them. Well, if that's done enough times, then that behavior is reinforced, and before you know it, the child actually has learned this behavior. So that the tantrum didn't start off being it was just more of a dysregulation. Child didn't have control over it, but now they have learned a pattern that works for them, and they might continue to do that. So we want to be very careful not to reinforce some of these tantrums. And the best thing, again, for young children is probably just to do a lot of redirecting. Now, we use the term meltdown when it occurs kind of beyond that terrible 2 stage. And a meltdown is kind of more when a child just loses control to the point that they wear themselves out, or the parent needs to calm them down. They just cannot regulate their emotion. And those emotions are often anger or anxiety. Anger is probably the #1 emotion that causes children to have meltdowns. Maybe they can't have something, a toy, a video game, again, a candy bar. They become overwhelmed by their frustration and that kind of sense of injustice. And they don't understand why sometimes. So that can be partly developmental. Like, I don't understand why I can't have a cupcake 30 minutes before dinner, or why my 11-year-old brother gets to stay up later than me. So they don't get that bigger picture. They can't abstract. So again, partly developmental. And then another major trigger for these emotions is anxiety, and that can be separation anxiety, separating from the parent, a social anxiety, I'm afraid of other people, a specific anxiety, a specific fear that they may have. So those are all common emotions that kids are exhibiting during a meltdown phase. There are other things that contribute to emotional regulation. And a lot of times kids that are having these outbursts just lack those skills. One is impulse control, just having some control over your impulses. And that's why sometimes we see this more in children with early signs of ADHD. Being able to problem solve, again, communication, being able to delay gratification, and self-calming. Those are things that are necessary to gain control over your emotions. We also know things, again, like ADHD, anxiety, learning problems, depression, sensory processing issues can all lead to meltdowns. So I often think of these explosions or meltdowns that occur kind of in these stages. So the first stage is there's a trigger, and we have to try to figure out what that trigger is. And then there's this build-up phase. And during that build-up phase, the child, you can sometimes see it in the child's eyes. Their eyes get wide. You can start to see it in their face. They may tense up their body. And you're starting to become aware that that's going to happen. The parent starts to get to know their child before they go into this full-fledged rage or pure emotion. And during that pure emotion stage, they are in a rage and they are not rational. And then you have a recovery. One thing I want to point out about that pure emotion or rage stage of this whole meltdown is that, again, children are usually not rational. So what you don't want to do, and it's a mistake a lot of parents make, is they start talking to them about consequences or, I'm going to be taking away your iPad, or I'm going to call your father, or something like that. And that usually just makes it worse because, again, they are not rational. They are pure emotion during that time. So we want to be careful not to talk about things, especially during that pure emotion stage. You talk about things later. But what you can do is we can try to find times during that build-up stage where we can maybe distract the child at that very early build-up stage. We can see it coming. Maybe turn on a TV show. Maybe send them to go get on an errand for you, or having them help you do something fun. And for the older child, that's the part where we really want them to start to learn to use more socially appropriate words. And that's when you may start to say, you look really disappointed, and we start to get them to verbalize a little bit more. And again, we want to get back to those triggers and figuring out those triggers. So what are triggers? You want to really get to know your child's triggers, and that's just kind of being a mindful parent. It's important to be aware of your child and what sets them off. The most common ones are children are hungry, they're sleep deprived, they don't like loud, big crowds or noise, or they get overstimulated. They have a fear, and we may know that fear, and we may not know their fear. And another one is transitions or change. So just some basics on sleeping and eating. Again, sometimes kids are picky eaters and they just don't eat well, and they may have missed 2 meals and they're cranky, and we're not even aware of it in our busy lives. So I would just always try to keep some healthy snacks with you all the time. I tell parents, when you pick a child up from school, sometimes they're tired, they're hungry. You may just want to give them a snack before you even talk to them. So keeping those snacks there. And knowing kids get sleep deprived, and when they're sleep deprived or they're sick, their behavior is off. So during that time, you want to cut them some slack. You want to expect some behaviors that are not perfect. And it's a time that if you see that, don't set yourself up for failure. Don't bring them to that party. Don't try to do something late at night if they're not feeling well or they didn't have a good night's sleep the night before. Other things that parents can do to prevent these meltdowns: routine. So children just do much better with routine. They like their schedule. We all do better with routine and scheduling. It just helps them feel more secure and less anxious. Sometimes kids do better when they're offered choices, and that's going to depend on the child. For example, in a doctor's office, a child needs to get their immunization. Do you want it in your right arm? You want it in your left arm? So they have to have it, but maybe they feel better if they have a little control over the situation. There are other kids that just do not do well with choices. And again, you get to know your child. And then another thing is just having limits and boundaries. So setting consistent limits and boundaries can help children just understand expectations and reduce frustration. They do much better when they know the rules. Post the rules, put them up, keep it really simple. It could be something like, no hitting, no bad language, but those are the basic rules, and then they're written, and there's no misunderstanding about what the rules are. Another thing that can cause meltdowns, again, are these sensory issues. Sensory processing refers to how our nervous system receives and interprets information from the senses. And that includes touch, taste, smell, sight, sound. And some children are just easily overwhelmed by those things. And this is something we just can't really control as a parent. This is the, and we need to be patient. We need to be understanding. Eventually, hopefully they will be desensitized. However, if we understand them as triggers, we can do the best we can to minimize that. So try to avoid that large crowd. You can use headphones when it comes to noise. Have the child wear comfortable clothes. So again, this is a whole other issue that we could be talking about for a long time, but the biggest thing to know is they are a big trigger of meltdowns. Be aware of them, expect them, and again, try not to set your child up for these things if we know that they're going to cause meltdowns. Communication is a vital part of these meltdowns. So children need to be able to describe their emotions. You know how we talked about the terrible twos, and children have the tantrums because they can't communicate. Our children who have language delay. Well, there are some kids who have pretty normal language, but they are just not good at describing their emotions. They don't use emotion words. And then we don't know what they're feeling and what's going on in their minds. So one of the first things we want to do, of course, is to role model for them. So children model what they see. So if we as parents are losing our temper, kind of shouting at our spouse or the grocery person or the cable person, and our emotions are flying, children are gonna model after that. So be very careful and be looking to see if there are people in the household or things that they're watching that are showing that escalation of emotions, and be careful of that, because remember, children model what they see. So try not to yell. We want to label emotions. So we want to start to teach them those words: happy, sad, angry, frustrated. And there's lots of books for that. Read books about emotions, watch movies, and talk about the character's feelings. Oh, I think he must be really lonely, or he must be really sad. You can play games to look at facial expressions. Mirror, mirror on the wall, where's the silly girl? Where's the happy girl? So again, that we start to recognize facial expressions and start to talk about our feelings. So some basic emotions that we want to have the vocabulary for are being sad or safe or frustrated or lonely, brave, disappointed, scared. Those are all important words for children to know. I'm jealous, I'm happy, I'm frustrated. So giving them vocabulary and using those words over and over can help them to be able to express their feelings. You also want to have a safe environment and practice empathy and show your own emotions. So if a child is starting to use their words and is saying things like, oh, I'm scared, or I'm really sad, you don't put them down. We don't want to say, oh, you'll be fine, or oh, you'll get over it. You really want to be empathetic toward those emotions and talk to them about it. You want to start using phrases such as, I can see that you're feeling angry right now. And you want to show your own emotions. As parents, we tend to hide our emotions from our children, but it's important for them to see that we also have emotions and how we handle those emotions properly. You can rate the emotions, and that helps, and kind of using a scale of 1 to 10, where 1 is calm and 10 is furious. Again, and model your own emotions. Oh, I went to the grocery store and I can't believe I forgot the milk. I'm so disappointed. I'm so mad at myself. I forgot to get the milk. It's the one thing that I went to the grocery store for. But kind of show that emotion, say it, but then rate it. But on a scale of 1 to 10, it's maybe a 3 or 4. I'll survive. I'll get the milk tomorrow. So it kind of seems silly at first, but really being able to rate your emotions will help children to understand that. There's something called size of the problem, again, which we'll talk about at another time, but that's having the emotion match what the problem is. So when it comes to communication, again, don't assume your child understood your expectations. We have to be very, very concrete with kids. Remember, they're literal, they're young, they don't understand, and you have to simplify. You don't want to overwhelm them with multiple directions because that's too much. If you give them multiple things to do, they not only forget because they don't have good memory yet, but they also then become overwhelmed. What did they say? What am I supposed to do? I forgot. And that can be overwhelming for them. And then the other big thing is is praising your child when they do use those emotion words and any attempt to control their emotions. So again, we're on that kind of rising peak with the meltdown, and instead they catch themselves. I'm so angry. I'm so mad. And they use those words instead of having a meltdown that deserves a lot of praise, rewards, etc. So that we let them know that that's a very positive thing for them to be doing. So another thing I want to talk about that does create that can cause meltdowns is transition. So this is just a real common one for kids. Kids sometimes just don't do well with transitioning from one activity to another. So for example, I'm outside on the playground. The teacher says, okay, time to line up, time to come in the house. And the child flops down, no, I don't want to, or I don't want to go to school. I don't want to come in the house. And the child just flops because they don't want to change. And this is they're young, and children just often have a little bit more difficulty shifting. And there's a number of reasons why. They have a shorter attention span. They need more time to process. Kids who have early ADD symptoms, again, are not good at transitions. They have poor executive functions, which is and transitions is part of that. They may become emotionally attached to an activity that they are engaged in. And then there are some kids who just resist change. And so it's a common trait among a lot of children. So transitions are a major cause of meltdowns. So what are some strategies we can do to kind of stop that meltdown that occurs during transitions? One is to use a visual schedule and a visual timer. So in other words, we let them know what the schedule is. We show them a timer so that they're aware of what's going to happen. Then we give them frequent direct warnings. So directly to the child, Andy, 5 more minutes, Andy, 4 more minutes, Andy, 3 more minutes. So frequent and direct to the child, getting their eye contact and letting them know and having them watch the clock and letting them know the time is coming, but lots of warnings. You want to teach some transitional songs. So the cleanup song, clean up, clean up. Everybody does that to help them realizing that we're about to switch activities. You can use transition activities, something that's fun, play some freeze tag, do the ants go marching one by one, but some type of fun activity during that change that will make them a little bit more interested in making that transition. Sometimes a transitional object helps, having them special blanket or doll that they're going to come in and hold. That's another one. So visual supports can really be very helpful. Even if you have good language, just seeing that visual, again, just kind of keeps you focused, and you're using multiple senses now. So those visual supports are very good to help with behavior. These are examples of that visual timer, a timer that they can actually see, and they can see the time go down, and a visual schedule. A visual schedule is you knowing exactly what's going to be happening. You're going to be coming to school, then you're going outside, then you're going to be doing centers, then you're going to be doing the calendar. So again, that predictability can be very good for children. So there are lots of benefits of using visual schedules. Again, they provide a clear and consistent routine for children, and that can reduce anxiety and promote that sense of predictability. So how does a schedule work for a parent? So, I mean, these are, again, examples of school schedules, but a parent can make their own too. So you would basically, a parent would create a list of activities or tasks that they want their child to do during the day. And that can start off with, kind of getting dressed, brushing their teeth, eating breakfast, going to school, doing homework, etc. And then for each activity, the parent creates a visual, and they just create a schedule just like they do for school. Some parents may want to do a detailed one. Some parents may just want to do a short one. you want to review that schedule with your child ahead of time, go over it. What does it mean? Then you use it with the child. And then eventually, a lot of times children can start to just take out the schedule and use it by themselves. And it gives them that sense of familiarity, routine, and independence. And they start to be able to anticipate and initiate their own activities. So, and the other thing about having a schedule is you can put in when there's going to be a change. So on Wednesday, dad will be picking you up instead of mom, and you can put that right in their schedule so they can see it, because some children just don't do well with the change of plans. They get nervous. Again, children thrive on predictability. So having a schedule will allow you to put in those changes. Today, instead of going home after school, we're going to go to the doctor's office. And again, they're more prepared, and it reduces a lot of the anxiety. Another technique that I want to talk to you about is something called first then. And this first then technique is a behavior strategy that we use to help children with some challenging behaviors. And it breaks things down to two parts. The first of doing something that is maybe a little bit more difficult for them, that they don't want to do. So that's the demanding task. And then the then is the preferred activity or the reward that the child can engage in after completing the demand. So first you do your homework, then we get to go to the park. And it can be customized to fit the particular child, the specific needs of the child. First you wash your hands, then we can eat at the table. You can take pictures yourself, you can get pictures off the internet, you can get cartoon pictures, but that first then, again, even that the child may have good language, that visual tends to be reinforcing and providing more predictability. One last thing I want to talk about is what's called the emotional thermometer. And we'll talk about this a little bit more during the next session. But it's a tool that's basically a representation of a vertical thermometer with a range of emotions on it. And that's going to be something like I'm mad and I'm relaxed. And the child can then kind of look to see where they are on that particular thermometer. You know, are they at a 5 and they're really mad? And then if they are really mad, what can we do to take them down to that relaxed stage or that blue stage? And that could be taking deep breaths, that could be going for a walk. But it gives you those visuals so that a child can start to understand their own emotions and trying to work into a relaxed state. So just a quick summary of where we are at understanding these meltdowns. Again, remember triggers, and that's what we're trying to prevent. Keep thinking about your child's triggers. A lot of times it is the just being, I'm tired, I'm hungry. A lot of times it's sensory. A lot of times it's fear, and we have to be aware that a child may be afraid of certain things. They're afraid that parents are going to leave them. They're afraid of the dark. There's many things that they're afraid of. And then they go into that build-up phase, and it's during that build-up phase that we want to start to recognize, maybe redirect, and we also want to start to get them to use words as opposed to physically throwing themselves on the floor. And then their pure emotion, rage, that's a time you don't want to be talking to them and you just need to calm them. Again, we'll talk about that more next time, and then kind of your slow recovery. So at the next presentation, we'll talk again about preventative techniques, intervention during that escalation and emotion stage, and other behavioral strategies to help your child with emotional regulation. Thank you.